Now we'd like to go ahead with the press conference of Prime Minister Suga. First of all, we'd like to hear a few remarks from Prime Minister. The floor is yours, Prime Minister. Right before this meeting about COVID-19, we held a headquarters meeting, Saitama, Chiba, Tokyo, and Kanagawa prefectures. Regarding these prefectures, on 21st of March, the state of emergency declaration will be lifted. There was such a decision out of the meeting. So far, shorter working hours for drinking and eating establishments. We had a focused approach, and we were able to have tangible effects. For the 4 prefectures, the number of new infections, we had 4,277 as of the 7th of January. We have now 725 as of yesterday. We were able to cut back by around 80% or more. In Tokyo, from 2,520 to 323. This is a tally for today. And a per day tally, which is 500, which is a criteria for lifting the state of emergency. We were able to be below for 40 days or more. So bed occupancy, we had a strain in Chiba Prefecture. And day by day, the hospitalization cases are declining and bed occupancy rate 50%, which is a criteria for lifting the ban or emergency. We were able to make it below, and now it's below 40%. 2 weeks was the period for extension of the state of emergency, and we wanted to see bed occupancy rate with precautious approach. And I said that we will exercise a decision, and the criteria for lifting the state of emergency are being met on a stable basis. And today, we have decided to lift the state of emergency. So far, medical care and the elderly care centers, related peoples, gave us substantial efforts. And people and their operators gave us a lot of cooperation. Thank you very much for that. Regardless of that, the new infections are now being flattish, or we have even a slight increasing trend. And we have more traffic in some areas. So therefore, we have some concerns over backlash or rebound or resurge. New variants are also expanding. It takes some precautions. So therefore, now that we lift the state of emergency, this is a critical juncture. So we have to really see the situation in each region. The central government and local governments have to collaborate more closely so that we can take adequate actions on a continuous basis. There was a strenuous efforts with people of Japan. Not only that, collaboration with local governments and collaboration between different city hall and local governments. Under my leadership, there was a comprehensive coordination and effective actions will be taken going forward. And based on experience, we have a lesson learned: washing hand and wearing a mask, and avoiding 3 C's. These are the basic anti-infection measures that have to be shared and that have been shared across the entire society. Once again, I'd like you to abide by such practices. And about eating establishments, and we have some major events, and with that in mind, we need to take, once again, thorough measures in place. The government of Japan would like to make sure that we enhance our information communication so that the necessary actions can be communicated in an easy-to-understood manner. At the same time, any prejudice and discrimination have to be prevented. With that in mind, we'd like to go ahead with the right measures. And upon the lifting of the state of emergency, we have to prevent the resurgence of this spread. And we have 5 pillars and comprehensive measures were decided. The central government will collaborate with local governments to make it happen in a steady manner.
The first pillar is to prevent infections in the place of eating and drinking. Based upon the experience in the past, there are cases of conversation without wearing masks in 4 prefectures. By the request of each prefecture, it's possible for we are continuing the shortening the operating hours for restaurants and bars up until 9 p.m. And for that, 40,000 yen per day of assistance will be provided to the establishment. And also distancing between the seats and also ventilation inside the restaurants. It's important to establish guidelines. 4 prefectures in total per day, 10,000 or so of patrol activities are conducted, and will be further conducting activities in a more vigorous manner. The eating together is by the families, and the number is to be limited to 4 persons or less. Graduation ceremonies, school entrance ceremony, and farewell parties season is here. But for large people to enjoy dining, please refrain from having eating occasions by large number of people. Such message is to be communicated to wide range of generations. In addition to TV commercials, SNS and internet video will be using every possible media and will be conducting concentrated communication efforts, programs that has not been done in the past. Next pillar is response to variants. We will be strengthening surveillance system in Japan, and in all the prefectures, we are conducting tests on positive patients, and extraction sampling ratio will be increased from 10% to 40% level, so that we can identify and detect variants. At the same time, we will be identifying and detecting the source of infection to prevent spread of infections. By controlling the number of people who get on board the international flight, we can control the numbers. Such borders measures will be strengthened. The third pillar is to conduct strategic testing to find signs for infections in stations and in the entertainment districts. We are conducting the monitoring test for asymptomatic patients, and will be expanding these efforts in major cities. And next month, 5,000 cases, 5,000 people will be tested per day. And for elderly care facilities, 30,000 facilities will be subjected to testing by the end of next month. And from next month, in a concerted fashion, regular testing will be conducted. The fourth pillar is vaccination in a prompt and safe manner, including variants. The key for preventing infection is vaccines, and as promptly as possible, we will be delivering vaccines to all the people in Japan. With that in mind, we are making preparations for vaccination. So far, there have been some cases of side reactions reported, but according to the experts' evaluation, all are relatively mild in nature and appropriately treated, and improvement was made on side reactions. Priority vaccination for medical professionals are progressing smoothly, and now 80,000 people are vaccinated per day. From 12th of April, we will start vaccination for elderly people. And by the end of June, at least 100 million doses will be secured, at least. Medical professionals and elderly people, this is sufficient for medical professionals and elderly people, so that people will feel very safe in receiving vaccination. We'll be conducting communications in an appropriate manner.
The fifth pillar is preparedness for the next wave of infections. We have to have a better preparedness in terms of healthcare system. This time around, we couldn't prepare for a rapid surge. So in COVID beds, and we had a shortage of the medical care staff members and beds as well. In each prefecture, we need to make sure that we have the right preparedness for such resurgence. COVID beds and the beds for accepting patients and hotels accommodations for mild cases and care at home. So we have to divide roles and responsibilities so that we can effectively take care of the positive cases for care. So such comprehensive package will be done, and even after the lifting of the emergency, cash flow and the employment and the job adjustment funds and others will be supported. 2 days ago, life and job-related serious cases, and we have decided to compile the emergency package for those financially stricken people. Even under this situation, we have to prioritize the kids who bear the future. So for single-parent households and low-income households, 50,000 yen per kid is going to be provided. So the households below the threshold of low income, 100,000 yen for each month. And we will also provide expanded training occasions, and for digital training, the number of the people to be trained will be expanded to 5,000. And for small funds, so the new loans will be also continuing beyond April, and for the repayment for the residential tax, so there will be the exemption from next year and onward. Suicide prevention and monitoring the children. We have NPOs who are carrying such aspects. So once again, 6 billion yen support and package will be provided. On top of that, eating establishments who are providing a lot of jobs. In order to support their continuity, emergency package will be compiled as soon as possible. We have to make sure that we have no repeat of resurgence. So with such a determination upon this lifting, I'm saying to my message to myself as well. So each individual needs to be aware. So we will provide more capacity for PCR testing. And that way, at an early juncture, we'd like to see the signs of the rebound. And by vaccination program, onset and complication will be contained. And that way, we'd like to enhance medical system to provide a better preparedness for protection of the lives. So that is a system that we'd like to establish going forward. So we are causing a lot of restraints with many people. So the central government and the local governments will unify all the efforts to do whatever we can do. We are still fighting around the world. Within a limitation of 1 year, we still have many lessons learned. And above all, we have vaccination, which is a weapon. We have some progress and a setback, but at the end of the day, we will see the light at the end of the tunnel. So I will take the lead in order to protect lives and livelihoods of the people of Japan. With this determination, I'd like to put all my energy. Thank you very much once again for your cooperation and collaboration and understanding. That's all from me. So now, we'd like to take questions from the press. As for Dr. Omi, please proceed to a designated spot. And depending on the questions, Dr. Omi will give us some answers. And the people who are nominated, please proceed to the stand mic. And please state your names and affiliations. And please give us questions one by one. So first of all, we'd like to take questions from two representative medias. Japan Times, Sugiyama-san.
幹事社ジャパンタイムズの杉山
Sugiyama from Japan Times. I have a question to Prime Minister. Earlier, you said that you will be pressing accelerator and brake. But the second declaration of made, and on the timing for that, there are criticisms that it was a bit late, too late. And going forward, by lifting the declaration, if there's a spread of COVID-19, then are you going to flexibly brake and accelerate at the same time? If you are not able to do that and the situation deteriorates, then how are you going to be held responsible? And based upon the experience and lessons learned, how are you going to utilize that specifically for the measures to be taken in the future? First of all, in September, when I assumed the post of Prime Minister, since then, I have been protecting the lives of the people, and with that firm determination, I have been working very hard. And the daily infection status is observed and listening to the opinions of the experts and taking measures and looking at the impact upon the livelihood of the people. And I have been considering the impact upon livelihood of the people. And then they suspended the Go to Travel campaign and state of emergency declaration. Such necessary decisions were made and measures were taken. Based upon the declaration for the state of emergency, we steered toward preventing infections and asked the restaurants and bars to shorten operating hours. So we have been implementing pinpointed, focused measures. As a result, the number of new cases was reduced by more than 80%. So clear effects have been observed. On the other hand, as infection spreads rapidly and there was the tight situation on the hospital beds and also the hotels for the milder patients. So based upon that, in lifting the declaration, I'm going to prevent resurgence. And at the same time, 5 pillars that I have explained, comprehensive measures will be implemented sufficiently. And I'll be working closely with local governments, and would like to work for containing the infections.
Now we'd like to take a question from Hoshino-san of Asahi newspaper. Thank you. First of all, this is a question for Prime Minister and Dr. Omi. 2 weeks ago in a press conference, you said that the preventive measures and the enhancement of the organization will be in place in order not to have a resurgence. However, new infections are now increasing again over the last 2 weeks. In terms of the organization enhancement and the preventive measures, do you have enough measures? And this is the one for Prime Minister. If we have a resurgence, are you going to issue the third declaration of the state of emergency? How do you see the impact on Olympics and Paralympics by the Independence Day? And Mr. Biden would like to make efforts to make it normalized. How do you see this? So 2 weeks extension was made for the state of emergency and new infections and bed occupancy ratio. So these are below the criteria for lifting the state of emergency. And at this time, we exercise a decision based on the opinions of experts. And in order not to have another resurgence, we have 5 comprehensive package and pillars. And we'd like to thoroughly implement it. At any rate, another state of emergency should be avoided. So 5 measures have to be thoroughly implemented. I think that is my duty. And about vaccinations. For onset and the complication prevention, there is some effect, according to what some point out. So in order not to have a spread of the COVID, this is quite an important point. So one by one, by containing the spread of COVID, about Olympic Games, we have the IOC and President Bahar, with each operating and organizing committee around the world. There is a proposal being made, and the direction is that the games will be held. The preparations are underway with that in mind. So we'd like to support such effort.
2週間で十分
So whether or not we have the right preparedness after 2 weeks, that is a question. And within the 2 weeks, there were many different reasons for the extension. And one thing was, importantly, these 2 weeks should have been the period where we contemplate the measures for prevention of another resurgence. So therefore, different measures with the Japanese government and with the local governments, we wanted them to be prepared. So we have 7 points that we came up. And the measures which have to be taken in a nutshell. And of course, in eating establishments, we have to have shorter working hours. However, what we have to do in a nutshell, I would say, is something which is not on the extension of the current measures, which is we have to have a thorough circuit breaker being active. So we have to deep dive monitoring, and for the elderly, regularly testing has to be done, and new variants have to be also in surveillance. And of course, we cannot be always perfect in terms of being prepared, but at least in some prefectures, focused monitoring testing has been implemented, and deep dive testing, which is to rightly identify the sources of infection. So they have already started such activities, and for care facilities, there is also testing going on. In this regard, we can never be perfect in terms of preparedness. However, these are the things that we have already launched, and these are the things that need to be accelerated.
それでは
Now, I'd like to entertain questions from companies other than lead companies. If you'd like to ask any question, please raise your hand and wait until you are nominated, and then move on to proceed to the nearest microphone. Okanai-san from NHK, please. Osanai from NHK. I have a question to Prime Minister. 2+2 between the United States and Japan, the two countries work together to face China, including the leaders summit in the United States next month. How are you going to make contribution, including U.S.-Japan alliance? First of all, U.S.-Japan alliance, without needless to say, is the core of the diplomacy of Japan, Indo-Pacific, and prosperity of the international community. And this is a basis. I had telephone conversation with President Biden, and then the Quad leaders meeting, TV meeting, for realizing free and open Indo-Pacific. We have made clear the commitment. Japan also, U.S. is an ally of ours, and like-minded people. We work closely with the countries who share the same aspirations, and taking every possible opportunities, including Quad, we are going to strategically promote free and open Indo-Pacific. And if the circumstances permit, then early next month, I would like to visit Washington, D.C., and on that occasion, I will have the opportunity to deepen personal relationship of trust with President Biden and also work to further strengthen U.S.-Japan alliance and COVID-19 climate change and various issues including China and the abduction issue by North Korea. On these issues, U.S. and Japan will be collaborating with one another to address these questions. And we will confirm, we would like to confirm this between the two leaders.
Now, Nippon Keizai Newspaper, Shigeta-san, please go ahead. Nikkei Shigeta, I have a question for Prime Minister about vaccination program. The President Biden of the United States, once vaccination proceeds, then they will be independent of vaccine, the virus by the 4th of July. About the speed of vaccination, are you going to accelerate the speed of vaccination? Because there's a limitation to healthcare professionals in terms of the people who are administering. However, there is a wider scope in place in the U.S. How do you see this? So onset and the complication can be prevented by the vaccination program. So therefore, as anti-infection measure, this is going to be a critical one. And as for the government of Japan, as soon as possible to the people around Japan, safe and effective vaccination should be delivered. That is the passion that we have. And securing the supply of vaccines and financial support and support programs for local governments, on these fronts, we are putting all our efforts. And by the end of June, 100 million doses will be secured. And as for the administrators of the vaccination, in order to secure safety, the physicians and the nurses are the ones who are designated. And from the IOC president, there was a full endorsement which was expressed, as well as other parties. And going forward, we'd like to consider all different emergency situations, and large-scale vaccination program should be smoothly implemented. And to make it happen, we'd like to do everything that we can. About vaccines administration, I think Dr. Omi has what he has to say, I guess. About this COVID-19, in order to contain the virus, this is the essential tool. I think there are many different barriers, but the central government is doing everything it can. However, in a flexible manner, we'd like to deliver it to as many people as possible. That's my hope.
はい、それ
Now, from international media, Wall Street Peter Randall from Wall Street Journal, please. Randall from Wall Street Journal. I would like to ask a question to the relationship between U.S., Japan, and China. What is your thinking as you will meet with President Biden of the United States? First of all, as I mentioned earlier, if the circumstances permit, then in early next month, I'm going to visit Washington, D.C. to have summit meeting. In the course of that, at 2+2 the other day, we talked about U.S.-Japan alliance, and about Quad, we had a meeting, and also about the Japan-China relationship. We were able to speak very candidly. with a relationship of mutual trust between Japan and the United States, we will further make sure that the U.S.-Japan alliance will function, and various matters, issues are discussed. And in that meeting also, Japan-China relationship, climate change, COVID-19, various topics were taken up, and we are going to have very candid discussion on various topics at the summit meeting.
次また全
な共同通信吉浦さん。共同通信吉浦。I have a question for Prime Minister about the anti-infection measures and how do you call on young people. So in the Committee on Rules and Administration about the anti-infection measures, how you can deliver effective messages to the youth. You had a conversation with experts. So far in a press conference, different kinds of occasions, you were calling on the youth for anti-infection measures. However, it seems that it's not taking root. How do you see the root cause of the problem? Why is it not getting across? Are you going to, I think you are going to take advantage of TV commercials. However, rather than just communicating information, how do you think you have to take measures to make it resonate with the youth? When it comes to young generations, 60% of the untraceable cases and the cases as a whole, so it was attributable to the youth. So we have some problems associated with eating occasions, so we have to make it resonate. For example, SNS. We have some tools that we can use for the youth, and I think there was some shortage in terms of our PR, taking advantage of such tools. And I think that there is a lack or insufficiency of communication to the youth. So we'd like to deliver messages more robustly.
はい、それでは富士の
Kashima-san from Fuji, please. Kashima from Fuji TV. In the LDP, if the state of emergency is lifted completely, then Mr. Suga will have the free hand for dissolving the diet without waiting for autumn. And Mr. Shimomura was saying that next month, Prime Minister will be visiting the United States. And after that, there is a possibility for dissolving the diet. And then, on the other hand, there is a strong concern for the fourth wave. And there are some people who say that there is no room for dissolving and having the election. So what is your view about the relationship between these two? And also, the status of vaccination will that become one of the criteria for deciding whether or not to dissolve the diet? First of all, vaccination. It has to do with protecting the life and health of the people. And as early as possible, we should be delivering vaccines to the citizens. And I myself will take the measures against the COVID-19 so that we can contain the infection and variants and the inspection and the testing at the elderly care facilities. So for the 5 pillars of measures that I have explained, it is my role to make sure these 5 measures will be implemented. So dissolving the diet, I am not thinking about that at all. But at any rate, my term will expire in September. So it is true that we have to think about my term. But the topmost priority should be containing COVID-19. make sure that the COVID-19 will be contained. That's my responsibility.
続きまして
Now we'd like to move on to taking questions from Okawa-san, a freelancer. Okawa, freelancer, thank you very much. Thank you very much for taking anti-COVID measures. In 2003, I was observing SARS fears. At the time, the economy and the containment couldn't be managed easily. That's what I witnessed in the field. So therefore, for example, electronic money being provided to the citizens. So because it's time limited and without putting that into deposit, it can be used and consumed. And there are many eating establishments which are cooperating. So therefore, regardless of the time, I mean, the COVID prevention points can be probably distributed for soliciting understanding and cooperation from consumers. And that way, I think you can attach points to the people and the establishments which are struggling a lot. So you need to encourage the interest of the youth. So e-money and the points for prevention of the COVID. And for Dr. Omi, in 2003, I talked about the ship which serves as a hospital. And I talked about the crisis management farmers and vaccinations. And in order to save the crisis situation, I think it's going to take trillions of yen. However, maybe you can consider Made in Japan vaccinations program as well. And about the electronic money program. Yes, I will take your words because we haven't thought about it. So let me just take your words, and I will bear that in mind about the hospital ships or vessels. If we have a resurgence of patients, I mean, with a strain in medical system, just one idea you said. And actually, the health ministry, we have different laws and responsibilities divided among hospitals and how to utilize the existing beds and hospitals. So the health ministry is demanding a strong request from local governments. And I think it's going to be materialized at an early juncture. But I don't think that the hospital ships are within the range of their consideration. However, temporary care facilities, in this regard, I think prefabricated hospitals may be one option. Or it's at least worth considering. However, we need to prioritize things. So with the existing hospital beds, and how can we be creative and flexibly take advantage of that? I think right now we have to consider that point.
それでは
Thank you. Going back to the front row. Shitakubo-san from Chugoku Shimbun newspaper. Shitakubo from Chugoku Shimbun newspaper. I have a question to Prime Minister about the measures against COVID-19 in April. There's an election in Shimane and also the by-election in April as well. And also the contact with voters. What are the measures? And the diet men will be coming to the constituencies. And the risk of that. How do you think about the risks? And in Sai, Hiroshima re-election. Andy Kawai she is stepping down. And you have been supporting Andy Kawai when you're Chief Cabinet Secretary. And 150 million provided. Part of that is used for bribe, according to the evidence, to the testimony. You have not explained this. How do you think about that? Politics and money, the relation between two. People, general public have harsh view on that. So COVID-19 and politics and the money, can you please explain? First of all, in relation to elections, voters, we have to give consideration to the safety and security of the voters and take measures against COVID-19. And the election committee will be taking every possible measure to ensure safety. And so far, for example, in Shizuoka, there was an election, and in other places, elections took place under COVID-19. And the MIC knows about all these elections. So thorough anti-infection measures will be done, and also the active utilization of election before the voting before the election day. So various ways are possible to prevent infections, and also to avoid being crowded at the voting stations. Measures need to be taken. Now, will congressmen dietmen go from Tokyo to the constituency? It depends, depending on the prevailing situation in each constituency. As for fund, money, a number of times I have already explained. The party conducts its audit. But the documents are seized. So when the documents are returned, then as party, we are going to take appropriate measures.
はい、続きまして
Now, Yomiuri newspaper, Kuromi-san. Yomiuri newspaper, Kuromi. I have a question for Prime Minister. So with the revised special measures, though, key measures for the prevention of the spread, immediately, it has to be adopted for Tokyo, according to what some say. Are you going to utilize it immediately, and how are you going to make it happen? About the key measures for prevention of the spread of COVID-19, the way of thinking is this. In specific areas of each prefecture, we have the spread. And from there, to each corner of the prefecture, if we have a ramification and such a concern for such designated areas, the key measures will be implemented in an agile manner. So depending on how the infections play out, we'd like to monitor the situation, and we'd like to consult with the experts. Wherever necessary, we need to be able to use it, and we have to have the right mechanism. And that way, prevention of the spread of COVID-19 should be enabled. So that really depends on the situation. At any rate, we have a structure in place, so wherever necessary, we will put that into practice. The key measures, right? Yep. Regrettably, we had to issue the second round of state of emergency declaration, and one of the reasons is, simply put, circuit breaker did not function well. So therefore, what's the most important point is what situation dictates the circuit breaker or activation of the circuit breaker. On this point, between the central government, local governments, they have to be on the same page. But we need to have some objective criteria to exercise the decision. So experts with the government, and we try to collaborate with other parties as well. And so far, we had our stage 3 and 4 demarcation indicators that were there. However, what situation would dictate activating such a circuit breaker? We need to deep dive into more specifics. Next week, we'd like to make a preparation as experts. And about utilization, of course, that part is important. Shorter working hours at eating establishments On this front, I think there will be a continuation of infections in eating establishments. However, we have a diversification of clusters in metropolitan areas. So as we deep dive, we might be able to see some sources of infection outside eating occasions. So as a result of the investigation, if we have another source of infection outside eating establishments, we need to take other measures as part of the key measures.
Now, Bloomberg. Yamihiro-san, please. Nobuhiro from Bloomberg. I have a question regarding economic measures. From last year, the government has been continuing economic measures and fiscal expenditure. In Western countries, large-scale economic measures were taken, and for financing that, for example, large tax increase for large companies and wealthy people. So in Japan also, is a tax increase needed to finance this? And consumption tax, you said there is no need to raise tax rate for 10 years. Do you still maintain the same thoughts? Firstly, the difference between Japan and other foreign countries is that outside Japan, lockdown and a number of lockdowns were done. But in Japan, as you know, the measures are as we are seeing now. And Japan, 74 trillion yen of economic package was implemented. And we have the third supplementary budget to finance that. And next year's budget integrated with that. What is most important is to take measures against COVID-19. And for containing COVID-19, whatever is needed will have to be done. And we are going to finance that. For instance, with COVID-19, difficulties were faced by households and non-regular workers. So for these vulnerable people, the government is providing various support measures. So we are making fiscal expenditures. And it is true that this results in difficult fiscal balance in Japan. But more than anything else, in order to contain COVID-19, the government is taking every possible measure. That is of utmost importance. Finance only when the economy is thriving. So we are making all our efforts to counter and combat COVID-19. And thanks to that, we are seeing results. Unemployment ratio is the lowest amongst the developed countries at 2.9%. And we are managing at 2.9% unemployment rate thanks to our efforts.
Sorry, because of time constraint, we'd like to take two final questions now. TBS, Goto-san. TBS, Goto. I have a question for Dr. Omi. From next week onward, the experts from stage 3, instead of stage 3, stage 4, you're considering establishing the criteria. So we have the key measures, and are you going to set a criteria for staging such key measures? Is that right? From next week and onward, we have to gather all the wisdom. So it's not the work that we can do overnight. We need to exchange opinions with various parties. But what I said is last year, we implemented the concept of stage. But it's not perfect, and retrospectively, I would say the circuit breaker, which means when we need to activate the key measures, and beyond that, we have different indicators. And for the first time, we used the staging process or system, whether we have to replace them with different indicators or whether we have to add different indicators on top of that. We need to consider by collaborating between the local government and the central government, we had to exercise judgment. However, a swift decision could not be taking place in all occasions. So activation of the key measures is just one of the whole picture, or it's just one piece. Wherever necessary, then we have to change or add indicators.
フリーランスの方から
Last question by a freelancer. Azumi-san, please. Azumi, a freelancer. I have a question to Prime Minister. The other day, the National Police Agency has come up with a firm number about the number of suicides. 2020, the number of suicides was increased from 2009, increased by 912, of which the issue is women increased by 935. And while male decreased, female increased in terms of the number of suicides, those who conducted suicides, especially young people in their teens and 20s, increased by 520. So more than half of those increases are young people, of which most serious is the suicide of the elementary schools, the senior high school, and the junior high school, and 500. And especially female students was 138, which is double last year. On January 18th, you have given the policy statement and said that safety and the hope of the people have been pursued by you. But how do you look at this situation of the increase in the number of suicides and women and young people? What kind of measures will be taken to counter the situation women and the young people are in with COVID-19? The people who find no place to be in and are not able to work. So various issues are occurring as a result of COVID-19. And non-regular workers, we are providing support for non-regular workers. And the people who are not within the scope of the administration, the NPOs are helping them and volunteers nationwide. For those people who are providing supporting hand, the government will support them so that solitude, isolation will be avoided. And young people are consulting these NPOs by SNS, and the government supports these NPOs so that we can prevent suicides at any rate. Whatever we can, we will be taking every policy tool and being aware that preventing suicide is very important. We are implementing these policy measures. Thank you. With this, we'd like to conclude the press conference. There are still some people who are raising your hands. Please send your question by email, and then we'll be returning Prime Minister's response by email, and also will be on the website as well. I seek your kind cooperation and understanding. With this, we'd like to bring the Prime Minister's press conference to an end. I thank you very much for your kind cooperation. Thank you very much indeed.